Zika seems not to worsen Guillain-Barre symptoms. San Diego, researchers in Puerto Rico said they found no difference in disability rates at 6 months in patients with Guillain-Barre syndrome, GBS, linked to Zika virus compared to those with GBS alone, suggesting that GBS's course is the same whether it stems from Zika or other causes. But the GBS, Zika cases showed more signs of virus-related features such as cranial neuropathy, according to Emilio Erlikov, Ph.D., a CDC Epidemic Intelligence Service officer. Our analysis suggests that Zika virus infection does not trigger a more severe form of GBS, Erlikov told MedPage Today at the annual ID Week conference, sponsored jointly by the Infectious Diseases Society of American, IDSA, the Pediatric Infectious Diseases Society, PIDS, the Society for Healthcare Epidemiology of America, SHEA, and the HIV Medicine Association, HIVMA. Researchers have previously linked infection with the Zika virus to subsequent GBS cases, although the risk of GBS is thought to be small. For the new study, Erlikov and colleagues tracked 71 Puerto Rican cases of GBS with evidence of Zika and 36 of GBS alone. The GBS patients with Zika were more likely to be female, 52% versus 28%, p equals 0.017, but researchers didn't find statistically significant differences between the groups in terms of age or days of hospitalization. We were surprised that Puerto Rico GBS patients with and without evidence of Zika virus infection were clinically similar, Erlikov said. For example, there was no difference in terms of the time from antecedent illness to onset of neurologic illness, contrary to other reports that only examined this time step among GBS patients with evidence of Zika virus infection. In terms of antecedent illness, rash was much more common in GBS, Zika patients, 51% versus 8%, p less than 0.001. Joint pain and rhinorrhea were also more common, p equals 0.032, 0.004, respectively. As for neurological symptoms, facial weakness, 62% versus 28%, p less than 0.001, and dysphagia, 54% versus 25%, p equals 0.005, were much more common in GBS, Zika patients. Shortness of breath and facial paresthesia were also significantly more common. Previous reports have also indicated higher rates of cranial neuropathy, Erlikov said. These findings suggest that the cranial nerves may be targeted by either virus or antibody, he said. GBS, Zika patients were also more likely to require intensive care, 66% versus 44%, p equals 0.031, and mechanical ventilation, 31% versus 11%, p equals 0.024. There was no difference in the disability at clinical nadir, and hospital mortality rates, and disability measured by 3 different metrics at 6 months post-neurologic illness onset, Erlikov said. At 6 months, the remaining patients, N equals 27 for GBS alone, N equals 60 for GBS, Zika, showed no difference in disability, although the GBS, Zika patients had more tearing, eye dryness, drinking difficulties, and reported pain. Clinical virologist David Smith, MBBS, of the University of Western Australia, who was not involved with the research, cautioned that the study identified cases based on hospital coding, which can be inaccurate, and they didn't directly assess or classify the patients. Other studies have used stricter criteria for diagnosis and follow-up assessment. Consequently, he said it remains possible that Zika virus could worsen GBS, although the study does strengthen some of the previous findings about GBS, Zika. In a separate study reported here, researchers led by Lena Villa of the Universidad Nacional de Colombia prospectively analyzed 20 GBS, Zika patients, 75% male, median age 45, at hospitals in Valledupar, Colombia, and also found a course similar to what is seen in non-Zika GBS. At a median follow-up time of 193 days, 80% of 15 remaining patients had functional independence in regard to basic functions. 40% had paresis in 4 limbs, 27% had difficulty walking and 27% had hyporeflexia or areflexia. When compared to GBS secondary to conventional triggers, the outcomes seem to not vary much. It is reassuring to know that even though we are dealing with a new threatening pandemic, the long-term outcomes seem to be fairly equal to GBS in general, neurologist Ivan Roque Ferreira da Silva, MD, PhD, of Rush University in Chicago, told MedPage Today. Da Silva, who was not part of the study, praised it but added, "My biggest concern is how testing for Zika infection was done, as only serologies were performed. Cross-reactivity among Zika and dengue is frequent, even more in a country with endemic presence of both viruses.